joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined today by London Mayor Ed Holder, the Warden of Middlesex County, Alison Warwick, the Acting Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers, and the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. Happy to have the members of the media along this afternoon as well, and appreciate you joining us as we always do. And if you do have questions for any call this afternoon, you can just ask those by clicking on the question mark inside the text bubble here on Microsoft Teams at the top of the screen. And when you do, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those who are tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and those who are joining us on the CTV London website. Let's get to our opening remarks, and we'll start this afternoon with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. While we continue to see signs of hope and encouragement, at the same time, we continue to be reminded of how vicious and relentless this virus remains. As you know, the health unit today reported 4 more deaths. We've now had 14 people die with COVID in London, Middlesex this month alone. At the same time, we're seeing increases in hospitalizations and ICU admissions begin to slow and potentially stabilize both here at home and across the province. The Premier today also hinted at, in his words, quote, positive news by the end of this week where existing restrictions and public health measures are concerned. Well, what that announcement entails or what updated restrictions might look like today, well, nobody knows at this point. Regardless of what happens, though, we must continue doing all we can to help ourselves and to keep each other safe. One of the major unknowns right now is the impact of this week's return to in-class learning for tens of thousands of kids right across our region. But I am encouraged to see that more than half of our 5 to 11-year-olds now have 1 shot, while 93% of the 12 to 17-year-old crowd has 2 shots. Bravo. As we've seen in previous waves, as we continue to see during Omicron, those who are vaccinated, even if you've only got 1 shot, are much less likely to develop severe illness compared to those who are unvaccinated. Something else that gives me comfort and even pride is how many Londoners have rolled up their sleeves for a 3rd shot. We're up to 42% overall, and well over 70% for our most vulnerable populations based on age. Those kinds of numbers will go a long way towards ensuring our healthcare capacity will not ultimately be overrun, meaning we're able to provide more timely care to those who need it most. And regardless of how frustrating our situation may sometimes appear, no one can deny that we're in a much better position today than we were, say, a couple of weeks ago. I suspect our position 2 weeks from now will be even better. We're getting there, and this time once we arrive, we'll have the tools in place to ensure we stay there. And we've got vaccines, we have therapeutics, and we have a better knowledge of how to best protect ourselves against the virus. Let's keep moving forward together. Let's get the shots. So that's it for me. Let me turn it now over to Middlesex Warden Warwick, please.
Madam Warden, I think your microphone may be muted. All right, we're going to come back to Warden Warwick in just a moment. Let's hear from Dr. Alex Summers, Acting Medical Officer of Health at the Middlesex-London Health Unit.
Thanks, Dan, and we'll get back to Warden Warwick as soon as we can. Thank you to the media for joining us today. COVID rates continue to be high in our region. However, some early indications are consistently suggesting that we are seeing a plateau in the burden of illness in our community. However, it is important to note that the rates of COVID-19 and the burden of illness in our community remains exceptionally high and higher than it was prior to any wave before this Omicron-driven wave that we've experienced over the last number of weeks. Tragically, we did report 4 deaths today, a reminder that this pandemic does not just have mild symptoms, but also results in very severe outcomes, hospitalizations, ICU admissions, and tragically deaths. However, we continue to see good news in the form of vaccination, where we are now seeing over 75% of those over the age of 70 having received a booster dose. We've seen a remarkable increase in willingness to roll up sleeves and get vaccinations done, and we're reporting our new vaccination coverage today with nearly 1,025,000 doses now having been delivered in the Middlesex and London region. There continues to be appointments available at our mass vaccination clinics. There's approximately 5,000 available appointments if you go on to book today. We encourage anyone who's had a booster dose scheduled for February to visit our website at covidvaccinelm.ca and consider moving your appointment up earlier in order to get your vaccine as soon as possible. If you are able to move up your vaccination appointment, canceling it is easy as well through covidvaccinelm.ca. And I encourage you again to see if you can move your appointment up so that you can get vaccinated as soon as possible. Our 5 to 11-year-olds are also continuing to get vaccinated, and we are seeing 54% of them now having received at least one dose. That's an increase of 4% from last week. With the return of in-person learning yesterday, it's critical that parents and guardians book their children to get vaccinated as soon as possible and as soon as they are eligible. Children that are 4 will be eligible the day that they turn 5. So if you have a child that's turning 5 within the next little while, start to get ready to book that appointment so you can get them vaccinated as soon as possible. Schools are back in session, and as kids return to the classroom this week, it's critical to remember that learning in person and going to school is the essential work of kids. Children have been out of school 27 weeks in Ontario, longer than any other jurisdiction in Canada, and we are glad to see that kids are back in school. It is important to also remember that there are ways that we can reduce transmission as kids return to school, most notably through making sure that vaccination happens as soon as people are eligible, not just for the kids, but for everybody at home and for everybody who's a close contact with a kid. It's also important that symptom screening is done each and every day before school so that kids don't go to school while ill. We also want to make sure people are wearing your mask appropriately and with a good fit. And of course, limit all your non-essential activities outside of school to disrupt transmission as much as we can in order to keep that essential workplace of children, the school, open and functioning. We're really glad to see kids back in school, even in the midst of a snow day, so that we can get back to that in-person learning. There's ongoing resources available on our website at healthunit.com, including a new resource to help provide some guidance around the self-isolation requirements if you do have symptoms of COVID-19 or if you test positive and have not received a phone call from the health unit. That new resource is available online, and I would encourage you to check it out. It helps provide the guidance on what to do if you have symptoms of COVID-19, if you test positive for COVID-19, or if you've been exposed to somebody with COVID-19. With that, I'm going to pass things over to Adam Dukelow, Dr. Dukelow from the London Health Sciences Centre. Dr. Dukelow.
Thank you, Dan, Mayor Holder, and Dr. Summers. Hopefully we can hear from Warden Warwick soon. I appreciate the opportunity to be here to share an update on COVID-19 at London Health Sciences Centre. As of this morning, we are caring for 166 COVID-19 positive inpatients, with 24 of those patients in critical care. In our children's hospital, there are 6 inpatients with COVID-19, and 5 or fewer of those are in pediatric critical care. At this time, we have received 5 or fewer critical care patients from hospitals outside of our normal referral network and continue to be available to provide further support as directed by the Ontario Critical Care COVID Command Centre. Responding to this large number of COVID inpatients requires the ongoing reduction of scheduled services, including procedures, surgeries, and ambulatory clinic appointments, to enable reassignment of staff and the use of inpatient beds that would normally be used for post-operative or post-procedural care for medical patients. As soon as we can, we'll increase these services once again. With the current growing number of COVID-19 patients, we are also beginning to work with neighboring hospitals to explore our option of moving ward-level patients from LHC to community hospitals. This will enable LHC to continue to fill our role as a tertiary and quaternary resource in our health system. and has worked well in past waves of COVID. As of right now, there are no concrete plans to transfer ward level patients from London to our partners, but we anticipate this may happen in the coming days. We currently have 8 units on outbreak. This includes 6 at University Hospital and 2 at Victoria Hospital. As cases increase in the community, this becomes reflected within our hospitals. In previous waves, this led to a domino effect on more staff and patients getting COVID, thereby increasing the likelihood of outbreaks. Unfortunately, LHC is also not unique in this situation, as many hospitals are seeing increased outbreaks across the province. This can largely be attributed to the fact that Omicron is so much more contagious than previous variants, and that many who are vaccinated are asymptomatic. We are testing every patient when they're admitted to the hospital. They are then moved into either a hot ward, or with patients who have COVID if they're positive, or a cold ward where the patients have already tested negative for COVID. If patients are moved, they are also tested before entering a different floor or unit. When an outbreak is declared, we immediately undertake a number of actions, including enhanced cleaning measures, restricted movement of patients and staff on affected units, surveillance testing of staff and patients, and contact tracing to minimize spread. We also work very closely with Dr. Summers and his team at the health unit to ensure we are minimizing the impact of any outbreak. Going forward, we will also continue to work with our infection prevention and control team to evolve practices. With new variants, we adapt our practices and look what we can do to reduce the likelihood of further outbreaks. We want to assure our public that our precautions, practices, and protocols to address COVID-19 and Omicron are effective and are being followed very carefully. Despite the outbreaks we are currently managing, London Health Sciences remains open and safe for patient care. Thank you again for having me, and I look forward to your questions.
Thank you very much, Dr. Dukelow. We're going to go back to Warden Alison Warwick. Warden Warwick.
Thank you. And I feel like I am the poster child for rural internet. I just had to run from one room to the other and hold this by a window. So here I am. Thank you for allowing me to be here today. It's always a pleasure. So the county's had a few busy days making sure that the roads are clear, allowing everyone to get back to work, and finally some of us getting back to school. Our pop-up clinics are able to keep open, with Lucan hosting yesterday, and today was hosted in Park Hill. I was pleased to volunteer in Melbourne on Friday, where a drive-through clinic was organized, allowing drivers to enter the fire hall and exit without leaving their vehicles. At the same time, other attendees were given the option of parking and entering the Middlesex-London paramedic special operations bus, where vaccines were being given. This led to an efficient use of everyone's time and cut down on the wait time. In the first week, 2,194 vaccines were administered at the pop-up clinics. Amongst these doses, 161 people received their first dose. This is very encouraging, as it means that the education being provided is working, and that people who may not have been comfortable have had the opportunity to consider and make the responsible choice. Once more, I want to thank the paramedics who are working at these clinics, as well as the support of Dr. Summers and his team, the host municipalities, and the dedication of the SERV volunteers who make this a positive, friendly environment. The county residents are very appreciative that this service is giving them the opportunity to stay close to home. During these January days, I just want to remind everyone it's really important that we support our local businesses as well. And hopefully our restrictions are eased off soon and these restaurants can going back to doing what they normally do best. So thank you again for this opportunity.
Thank you very much, Madam Warden, and Mayor Holder as well, Dr. Summers and Dr. Dukelow. Let's get to the questions. We do have a lot of them in the queue, so we'll start with one from Jane Sims at the London Free Press. Dr. Summers, this one is for you. The health unit had another reminder Monday that there are vaccine appointments this week at Earl Nichols. I want to ask why, and if you are concerned that people aren't stepping up for boosters. Are people not booking shots, or are appointments that were set aside for special groups, such as education workers, going wanting? Does that mean the members of special groups aren't getting vaccinated?
Thanks for your question, Jane. We are seeing across all groups a slowing of demand for the booster dose, which is largely anticipated and consistent with what we've seen for vaccine demand throughout this pandemic. Across our community, we have folks that are going to be the first in line or as close to the front as they can get to getting a first, second, or third dose of the vaccine. We'll then have some folks that may wait a little bit, but not too long, and then we'll have some folks that may wait even longer. So we always see this ramp up that's very quick, and then things start to level off. And that's what we're starting to see now. I do want folks to get vaccinated as quick as possible. I want that ramp up to be as sharp and as high as we can possibly get it, which is why, again, I'm emphasizing how critical it is to get vaccinated. I know we've heard with frustration the fact that this vaccine from 2 doses is not as effective against the Omicron strain as it is against the Delta strain. And that's true. However, it still remains your best protection, particularly with you when you have a booster, and particularly when we're talking about the risks of hospitalizations and death. Omicron transmits rapidly. We are seeing way more cases than we've seen at any other point through this pandemic. And it is the vaccine that is keeping that case number from being even higher than that. And most notably from keeping our hospitalizations from even being higher than they are right now. Our hospitals, as you've heard from Dr. Dukelow, are under stress across the province. That stress would be significantly worse if not for the first, second, and third shots that our residents have undertaken to go and get. And so again, as much as we're seeing things plateau, I think it's largely predictable. It doesn't mean it's not a thing that we want to work on. We want to see that go up as quick as possible, but I don't think it's consistent to any particular group. I think it's across the population.
Thank you very much, Dr. Summers. Let's go to the next question. It's a follow-up from Jane Sims as well. Dr. Summers, there are indications, and you mentioned this as well, that the test positivity rate in Middlesex-London is turning a corner and possibly signaling Omicron's deceleration. Is the worst behind us? Do you think the perception that the wave is slowing down is stopping people from seeking out those booster doses?
Thanks for that question, Jane. I think the accelerated rate and the exponential growth is plateauing, if not has plateaued. However, I want to emphasize that our current reality remains remarkably higher than any other time in the pandemic. And the slowing in the acceleration that we're seeing is because of the public health measures that were put in place and the massive reduction in mobility and social contacts that people in our community have had, in addition to the rapid uptake of booster doses amongst our community. We have to continue to mask, maintain physical distance, get boosters in order to slow the rate of Omicron transmission through the community. I want to remind folks that our objective here is to slow the transmission of Omicron through our community, not necessarily to stop it. We need to slow it so that we can still maintain our health service capacity. We are slowing it effectively, though, through masking, through boosting, and through maintaining physical distance as we stand. For those that are concerned or even more hesitant about getting the booster dose, now that things are plateauing, I would emphasize to you that the risk of Omicron will remain well beyond the peak of this wave, and that getting a booster now remains absolutely critical to protecting yourself and protecting our community as we move forward. I don't think that the waning or the slowing of the acceleration is necessarily deterring people from getting the vaccine as we speak. I think this is somewhat an anticipated slow, but I want to emphasize we need to still rush, we need to still run, don't walk, to get that booster dose as soon as you can.
Let's go to the next question, and it's another one from Jane Sims. Dr. Summers, for you. Dr. Summers, you said last week that this week mobile vaccination teams would be seeking out homeless and underhoused people for booster shots. Has that begun? And can you discuss why this group is a priority right now?
Thanks for that question, Jane. Yes, that work has begun this week. And so we are actively, through our mobile efforts, reaching and attempting to reach those who are homeless or underhoused. That group of individuals is a priority for vaccination for a few reasons, and particularly for the mobile team efforts. Firstly, it's a group that has challenges getting to a mass vaccination clinic or to a pharmacy to get the vaccine because of all the competing demands in their lives that make it challenging to get to those sites. That's one reason. Number two is they're individuals that are living in circumstances where they're not as easily able to physically distance, or of course, and sadly, stay home, given the very nature of their circumstances. And as a result, they are not able to utilize the physical distancing measures that some of us are able to utilize in order to disrupt transmission and protect themselves. The third reason is that many people who are homeless or underhoused also have other medical comorbidities or medical challenges, which make them more vulnerable to poor outcomes if they do get COVID-19. And as a result, the booster dose is all the more critical to protecting them from those severe outcomes. So for those three reasons, this group is a priority for our mobile team efforts.
Thanks very much, Dr. Summers. And Jane had another question, and there were actually several media in attendance this afternoon who have this question, and it relates to the vaccination status of the 4 deaths that were reported on the health unit's dashboard update today. Dr. Summers, do you have that information?
Yes, thanks for that question. 3 of the deaths that were reported today had received 2 doses of the vaccine, but had not received a third. 1 of the deaths reported today had received a third dose. So 3 of the deaths had received, 3 of those individuals who have died had received 2 doses, but not a third. 1 of those individuals who has died received 3 doses of the vaccine.
All right, thank you very much. And let's go to the next question. This one is for Dr. Dukelow, and again from Jane Sims at the London Free Press. Dr. Dukelow, do you know how long the average hospital stay is for someone who presents with COVID-19 symptoms but is fully vaccinated?
Thank you very much, Jane. It's a great question, and at a high level, I know it's shorter than those that are not vaccinated, but I don't have an exact number for you. We can certainly try and follow up with our current data sources to answer that question.
All right, let's go to the next question. Andrew Graham joins us from Global News Radio 980 CFPL, and his question is for Dr. Alex Summers. Dr. Summers, has the Middlesex-London Health Unit observed any instances of vaccine waste tied to clients canceling their vaccination appointments at the last minute upon learning they won't receive the brand they desire? Perhaps they wanted Moderna and are instead receiving Pfizer, or vice versa.
Thanks for that question, Andrew. Truly, on the whole, we've seen relatively minimal, relatively small numbers of folks that would walk away from a Moderna vaccine when they've had the opportunity to talk about the concerns they may have. So no, we have not observed wastage throughout the course of the day. We monitor our use depending on appointments and throughput and all that type of thing. But on the whole, we see very, very few. We see very, very little vaccine wasted as a result of the typical no-shows we may see during the week. We actually, we budget for a degree of no-shows, so we actually have some additional appointments in the system anticipating a small number of people won't show, so we over budget our appointments in order to deal with some of that. But to the question at hand about wastage as a result of people walking away, it's really, in the big scheme of things, a very small number who will turn down a Moderna just because Pfizer isn't available.
Next question is a follow-up from Andrew Graham at Global News Radio. Dr. Summers, I know there's hardly any data yet, but are you able to share how the return to in-person learning has gone so far from the Middlesex-London Health Unit's perspective?
Thanks for that question, Andrew. Yeah, again, very early on. Obviously, school just went back yesterday, so I don't think I have much to share on how it's gone. I think the school board probably has a better line of sight as to how things are going. We, given all the work that the school boards have done and their experience to date, we're very confident in the preventive efforts that have been done by the school boards to again reduce the risk of transmission in schools. But again, these are still early days at this point.
Let's go to the next question. And Andrew's got another question. Dr. Summers, can you elaborate on why the current Omicron wave appears to be plateauing?
Yeah, the major reasons are 2. One is a reduction in the number of contacts that any given individual in our region has as a result of the post-holiday public health measures. Those reduction in contacts has been notable across the province. There's been quite a reduction in mobility, which is which is reflective of a reduction in the number of close contacts. And I'm sure each and every single one of us, if we reflect on the number of contacts we've had in the last while relative to the contacts we may have had in December, would conclude that that has reduced in number. That is really a very significant impact in what is resulting in the plateau. The second major reason is the ongoing uptake of the booster dose that is reducing symptomatic transmission, certainly in some way, but most notably, of course, severe outcomes and hospitalizations. The other reason is that Omicron is working very quickly, and those to whom we're seeing people that are now have been exposed to become cases are now resolved. So there's also less people that are vulnerable between those that have been infected and those that have been boosted in the population on the whole, and eventually that is how things start to plateau. So those are the reasons that I think we're seeing this plateau as we speak.
So no one single reason, it really is a combination of factors all coming together at the same time. All right, next question is from Angela McInnes at CBC London. Dr. Summers, this one is for you. Angela asks, will London be getting Pfizer's new Paxlovid pill, and if so, when?
Yes, so lots of excitement around the announcement and approval of Paxlovid, an antiviral that's a therapeutic that is used as a treatment in an outpatient setting in an oral form for COVID-19. Not aware at this point, I'm not aware of the timing of when that will be distributed in the province, nor how it will be distributed. That will be through our health system partners, but we don't yet have a line of sight on the timelines. I am confident it will get to Southern Ontario, but I don't quite know when.
Thank you very much. A couple of follow-up questions from Angela McInnes as well, Dr. Summers. Angela asks, how much closer are we to in-school vaccination clinics?
Thanks for that question, Angela. Timelines aren't firm completely at this point. Preliminary plans are unfolding as we speak to provide in-school vaccination in a select number of schools for whom that community may have challenges with access to our mass vaccination clinics or other venues for administration of vaccine. So no firm timeline at this time, but certainly we're moving rapidly to essentially mobilize our mobile clinic operations to provide some support in certain select schools where vaccine uptake may be challenged as a result of access to mass vaccination clinics and other sites.
Thank you very much. Let's go to another question. And we've actually got similar questions from Angela McInnes and also from Christy Lee Barley at CTV London. So I'm just going to try to combine the thoughts here. 10 out of the 12 deaths that have occurred in January were in people who had been vaccinated. What do we know about underlying conditions and the vaccine? And Christy Lee adds, if we are not able to talk about those underlying health conditions, or if there weren't any, Dr. Summers, do you feel this is making the case for people who are vaccine hesitant, that vaccinated people are still dying with COVID?
Thanks for that question, Angela and Christy Lee. Two important components of my answer here. One is certainly the risk of death amongst those that are fully vaccinated is higher if individuals are older and have underlying medical conditions. I want to emphasize that that doesn't minimize the tragedy of those deaths. We do know, however, that older individuals, even if vaccinated, are more likely for severe outcomes than those who are younger, and age continues to be the most predictive. Age and vaccination status continue to be, I think, the most predictive indicator of hospitalization or death. These individuals, the 10 individuals in January who have died from COVID-19 despite being vaccinated, I think age certainly played a factor. And I can't speak specifically on all the different health conditions, emphasizing again that age and vaccination status are critical predictors of whether or not severe outcomes will happen. The second component of that question is, given that people who are vaccinated are dying and ending up in hospital, should I even get vaccinated in the first place? is a question based on an understanding of probability and an understanding of risk. Your risk of being hospitalized and dying from COVID-19 is significantly higher if you are unvaccinated than if you are vaccinated at every age along the way. In our community, a super majority of people are vaccinated, and therefore the rate of death is actually higher and maintains and continues to be higher amongst those that are unvaccinated, particularly at different age groups. So for example, the risk, if you're 50 years old, the risk that you will have a severe outcome or end up in hospital is significantly higher if you are unvaccinated compared to another 50-year-old who is vaccinated. That vaccine continues to be the best protection. It doesn't mean that people who are fully vaccinated are not going to have severe outcomes, but it means that the chance that they are is way less than if they were unvaccinated. And that's the critical variable here. The risks of getting vaccinated continue to be exceptionally low. The risks of not getting vaccinated continue to be fatal. Thanks, Dan.
Thank you, Dr. Summers. Let's move along to another question from Angela McInnes. Dr. Summers, how much of London's homeless or underhoused community has been vaxxed, relating to an earlier question we've had in the briefing, and how are those efforts going?
Thanks for that question, Angela. It's very hard for me to provide you with a proportion of the homeless and underhoused community that has been vaccinated because it's a very challenging denominator to assess and a challenging numerator as well. So it's hard to actually know what the size of the baseline community is, and also challenging to pull from the data how many of them have been vaccinated. So I cannot give you a proportion of that community that has been vaccinated. That community has been a priority, though, from the beginning of this vaccination campaign. We've had mobile clinics and downtown-based clinics throughout the pandemic to provide first and second doses, and now to provide third. Those efforts are always a bit of a slow go at times, again, because of many of the competing priorities that people who are homeless or underhoused face each and every single day. But we continue to go into the shelter system to work with other primary care partners to try and provide opportunities for vaccination in those settings as much as we can. This will not be our last trip to vaccinate in our homeless and underhoused communities. We will continue to go back and back and back, because that's the type of persistence that's required to meet people where they're at so that they can get the vaccine when they're willing and when they're able.
And we are on to our final question for this afternoon's briefing, and it comes from Andrew Graham at Global News Radio. Dr. Dukelow, this one is for you. Andrew asks, while Omicron may be plateauing in the region, Dr. Dukelow, are you noticing a similar trend among staff at LHSC? He's asking that while keeping in mind that staff infections have dropped by more than 100 cases since last Wednesday.
Thanks very much, Andrew. We've definitely seen a reduction in the number of staff and physicians at LHSC that are currently positive for COVID. Today's number is 374, and at one point, I believe 10 or 11 days ago, we were well above the 500 mark. It's excellent to see that our team members are recovering from COVID and able to return to work and serve the community like we know they all want to do. We've also seen a reduction in sick time, which is a reflection of individuals off for high-risk contacts and other reasons. So long story short, yes, we have seen a similar reduction as we've seen in the community amongst our staff and physicians.
Thank you very much. And we did get one more question just come in under the wire. And Dr. Summers, this one is for you. It's from Brent Lale at CTV London. Dr. Summers, do you feel the rapid test kits being given to students is an effective method? How important is it for parents to do the tests properly and to assess the diagnosis properly?
Thanks for that question, Brent. With our transition to managing our pandemic in a different way, we have transitioned to emphasizing that people don't wait for a diagnosis to take steps to self-isolate. If you have symptoms of COVID-19, or if your child has symptoms of COVID-19, it is critical that you isolate as soon as possible, or that your child isolates as soon as possible, and that your close contacts who live with you also isolate for 5 days. Everybody needs to isolate for 5 days when somebody in that household develops symptoms, regardless of whether or not you have access to a rapid test, a COVID test, and regardless of whether or not that test result is positive or negative. These are the critical steps to make sure that we limit the transmission of respiratory illnesses, most critically COVID, in our community. So again, to those rapid tests that are being distributed, if you have access to them and you have symptoms, it's certainly reasonable to test yourself. However, regardless of the result, you need to isolate for 5 days, and your household members also need to isolate. It really remains the most critical thing. So regardless of the test result, make sure you self-isolate if you have symptoms. The most important use for those rapid tests right now is to help with test to work protocols to ensure that critical staff are able to continue to work if exposed in healthcare settings like London Health Sciences Centre or other critical services where staffing might be a crisis.
Thank you very much, Dr. Summers, Dr. Dukelow, Warden Warwick, and Mayor Holder. That does bring us to the end of our questions for today and to the end of our time as well. We thank you for joining us for today's virtual media briefing. We will be back on Thursday, the 20th, just 2 days from now at 2 p.m. with our next virtual media briefing, and we hope you'll join us then. So between now and Thursday afternoon, have a great rest of your Tuesday. We'll see you Thursday, and so long for now.